Hello everyone, welcome to the health series. I'm Dennis.
I'm Ramata.
Today we are going to be talking about cervical cancer. It's actually something that is yearning and burning on people's minds, and I think we are trying to demystify it. Now, did you know cervical cancer is the second leading cause of deaths in women in Ghana? Actually, 3,000 women die yearly of cervical cancer in Ghana.
Yes, and then I know the question would be, cervical cancer is a disease or a cancer that arises from the cervix of the woman, usually considered to be the lower part of the womb. That's what people usually commonly call it, known as the neck of the womb.
Exactly. So just to illustrate, Ramata, so let's consider this bottle. If you look at the top of the bottle, let's say it's actually the womb where the baby stays for 9 months, and let's say the neck. So when the baby is ready to be born, it has to pass through this narrow passage. And the tip of the womb, which you call it the cervix, is the narrow passage where the baby comes from. And that's where all the problems arise when we are talking about cervical cancer. The virus that actually causes the cancer usually prefers to inhabit in this part of the womb called the cervix, and where most of the infections takes place and all.
This virus that causes cervical cancer is sexually transmitted, meaning that it is only contracted through sex, making cervical cancer a sexually transmitted disease, hence a highly preventable disease.
Exactly, and in fact, because it's transmitted through sex, it's one of the only cancers in Ghana that we know the cause, and we know that it's caused by this virus, right?
Yes. And the risk involved in getting cervical cancer initially used to be more common amongst our older women, but now it's common amongst our younger women. Surprisingly, but it's not to any surprise, because the risk involved in cervical cancer involves early sexual activity, which is very common amongst young ladies.
So does it mean if you are a virgin and you are bleeding, does it mean you have cervical cancer?
Oh no, not at all. Early sexual activity usually starts with the age of about 12 years and then thereabouts. So other risks involved include the early sexual activity, as mentioned earlier, multiple sexual partners, which we all understand, because if you start early, you're likely to have more partners before you even get to the age of 25 or 26. And by then you would probably date a man, or you'd have a partner who has multiple sexual partners.
I think people also complain of pain when they have sex, and I think it's one of the symptoms that have been identified in cervical cancer as well. Yes. Exactly.
So bleeding after sex, pain during sex, unusual bleeding vaginally, any bleeding you can't seem to explain, are all symptoms of cervical cancer. It doesn't necessarily mean you have cervical cancer, but then it's alarming, so you should still report to any hospital to be checked out.
Yes, so most young women between the ages of 18 and above can have pap smear. If you've never had a pap smear before, it's a simple test. All you do is that you go to the doctor's office, the simple swab is taken. It wouldn't take even more than 5 minutes, and then it's analyzed by the pathologist, and if you have any abnormal changes in your cervix, you're going to be told, and then treatment is given.
Vaccination is actually available for cervical cancer. In Ghana, we vaccinate our young girls, usually starting from the age of 10 and more, or any woman that hasn't started any sexual activity yet. But women who are sexually active can also be vaccinated. Just bear in mind, it's not as effective as a woman or a young girl who hasn't started any sexual activity at all.
So I think if you are sexually active, like Ramata said, it doesn't mean you cannot have the vaccine. However, bear in mind that you are not going to get 100% protection. It can give you about 60%, which is a little okay. But Ramata, I mean, looking at it as well, does it mean people should not have sex? You know, young people love sex. How can they have their sex and also prevent cervical cancer? What are your thoughts?
That brings me to one other preventive method, which is using a condom. Yes, you can have your sex, but please, please, please use a condom. Condom will not just protect you from pregnancy, but protect you from so many things, especially a sexually transmitted disease. And like we're talking about, our cervical cancer. So please use a condom. And in as much, don't have as many multiple sexual partners as possible.
So folks, today's section was about cervical cancer, and I think the message is clear. It's 100% preventable. All you need to do is to have pap smears once a year or once in 3 years, and vaccinate your young ones against cervical cancer, and it's actually preventable. So I think we'll sign off here. I'm Dennis.
I'm Ramata.
And see you again next time.
Bye-bye.